Hi, I'm Tom Geisel. At Sun National Bank, we believe that citizens need to be informed about the important issues that affect their daily lives. That's why we're proud to support programming produced by the Caucus Educational Corporation and their partners in public television.
Funding for this edition of Caucus, New Jersey has been provided by QualCare, Inc., a local managed care company covering 750,000 New Jersey residents, Verizon Communications, and by Sun National Bank.
Hi, I'm Steve Adubato. It is my honor and pleasure to introduce Dr. Sue Hassmiller, who is Senior Advisor for Nursing, Robert Wood Johnson Foundation, Director of the Future of Nursing Campaign for Action. I want to thank you for joining us, Sue.
I am so happy to be here.
We have you here to talk about the nursing situation in our state of New Jersey and in our nation. Robert Wood Johnson Foundation has been committed to this for several years because
nurses are the key to quality of care in this country. They improve patient care, with our mission being to improve the health and health care for all Americans. You can't do it without nurses.
So here's what's interesting. We've been doing some of this programming for a long time around nursing. Now, a lot of programs are about the nursing shortage. Do we have a nursing shortage?
Generally, at this point, we don't, because we're following the economy. The economy says that you need to stay in your job. If your spouse has lost their job, you go back into nursing. If you're a nurse, if you're a part-timer, again, hard times, you're going to full-time. So there's a lot of experienced nurses right now, but we're headed right into a nursing shortage again because of the age of nurses. The average age of a nurse is 48 and getting older by the minute, and our population is getting older, more chronicity, complexity in our hospitals and healthcare. So with all of that, we really are going into a shortage, and we need a lot more nurses, definitely.
And the other part of this equation, Sue, that the foundation has been very involved in is the shortage of nursing faculty. And the shortage of nursing faculty has a direct impact on the profession of nursing. Talk about the faculty shortage, right, involving nursing schools, and then what the foundation is very specifically doing about it.
Yeah, so we have in New Jersey about 75,000 students, qualified applicants who have tried to get into nursing school. That would be great. That would really help out this coming nursing shortage in New Jersey. But 1 out of every 4 qualified applicants has been turned away. Why? Because there's not enough teachers to teach the students.
Why not?
Because nursing faculty don't make the kind of money they can make in hospitals, in clinics, in the pharmaceutical industry. It's a great profession. I used to be a teacher of nursing, but we just don't have enough teachers coming in.
We should also make it clear, you are an RN as well.
I am a registered nurse, I am.
And that background clearly helps you doing what you're doing right now.
Yes, absolutely. As I said, I started out as a real nurse, right, in a hospital, and then taught nursing as well.
Talk about this whole question of many nurses, maybe most, correct me if I'm wrong, have a 2-year associate's degree, and there's a push to have nurses move to a 4-year degree, correct?
That's right, and I started.
And why?
I started in a community college too, so I have a 2-year degree, and then got a 4-year degree, then a master's and a Ph.D. Why do most nurses in this country have a community college degree? It's a lot easier.
Right.
It's accessible. It's more affordable. But the issue is most of the nurses in this country do have community college degrees, and then they stop. They don't go on with their education. What's wrong with that? You just talked about the faculty shortage. If they don't first have a baccalaureate degree, they can't move on and get a master's and maybe a doctorate and then teach. The same way with our incredible access to care issues in New Jersey. There are not enough physicians to take care of everybody, right? And so we need more nurse practitioners who can be there at the front lines for us. whether it's convenient care clinics or community health centers. We need those nurse practitioners, but they too have master's and doctorate degree. If you don't get people at the baccalaureate level first, they can't move along in their education. And then finally, with the great complexity of care, all this technology in hospital, people are much sicker, and we're trying to keep people in the community, in the home setting.
Right.
Nurses have to work very independently. And in order to work very independently and understand all this technology, you really first have to have a baccalaureate degree. So we're trying to move people in from an associate's to a baccalaureate at the very least.
So put in perspective for us the Future of Nursing Campaign for Action. Specifically, what is it? Because you also have 3 very concrete recommendations that try to address the issues we're talking about. Go ahead.
Right. Well, the Robert Wood Johnson Foundation has spent well over $300 million just on nursing issues in this country, a lot of it right here in New Jersey. A lot of leadership programs, a lot of help for nurses at the front lines. And our former board chair, who everybody is familiar with, the former Governor Tom Kean, right, said one day in a board meeting, we've done so much for nursing in New Jersey, and with him being the co-chair of the 9/11 Commission, being very fond of commissions, said, I think we need a commission on the future of nursing.
What a great idea.
And so I directed that commission on the future of nursing and had an independent committee that we worked with. Donna Shalala, the former Secretary for Health and Human Services, chaired that. Worked 2 years on this and came up with a number of recommendations, one of which was we need to get more nurses to a baccalaureate level. Another recommendation was we need to double the number of nurses with doctorate degrees. The faculty shortage,
That's
right? We need more faculty. I'll tell you 2 more.
Sure.
One is we need to allow nursing, and we had nurse practitioners in mind, but we need to allow all nurses to practice to the top of their education and training. Nurses are there at the front lines. They know what's best for patients, right? They have solutions, but there are laws, institutional policies that are keeping nurses from doing what they learned in school.
Right.
And so that was one recommendation, allow nurses to do that. The final one, nursing leadership. Nurses need to have a voice in patient care, in this country.
And excuse me, so is that the one where you recommended putting nurses on hospital boards?
It's an obvious one.
Because you told us right before we get on the air that only 6% of all board members are nurses.
It's an obvious one. And what do hospital boards talk about?
Patient care.
How to improve patient care.
Right.
And you know, we're thrilled that we have doctors on boards and policymakers and lawyers and wealthy people. But I think if you don't also have a nurse as a reality check saying, you know, I don't think that's really going to work.
Right.
You're not doing your job. Something's really wrong with the picture if you don't also have a nurse on the board.
Yeah, we've only scratched the surface. And by the way, we've been putting up the website throughout this program, throughout this segment. Please go on the website to find out more. It's up there right now. And also I want to make it clear that the Robert Wood Johnson Foundation, just in New Jersey, 61 nursing scholarships. And across the country, there have been hundreds, and there's more in the future.
Many, yeah.
Promise you'll come back, Dr. Sue Hassmiller, and talk about the progress of this very important campaign because it's an incredibly important issue. Thank you, Doctor. Stay with us. We'll be right back after this. Thank you.
If you would like more information on this program, or if you'd like to express an opinion, email us at info@caucusnj.org. Visit us online at caucusnj.org, or find us on Facebook at facebook.com/Steve Adubato, Ph.D.
We're now joined by Dr. Richard Goldweit, Chief of Interventional Cardiology at Englewood Hospital Medical Center. Good to see you, Doctor.
It's great to be here.
Put things in perspective for us. Cardiac care, how has it changed in the last 5 to 10 years?
Amazing.
Go ahead.
You know, it's been a real evolution in terms of what we used to do and what we do now. But the most important thing is that people really have a chance nowadays to really improve their outcomes. And also, it's just safer for patients.
How so? Give us one concrete example.
The bottom line is your chance of surviving, for instance, a heart attack is better than ever. The chance of dying from cardiac-related disease has dropped dramatically. And it's so important for the community, for people in this state to understand that there have been dramatic improvements in these things that really translate into improved care and outcomes for them.
But break this down a little bit more. Give us a sense of how you get there, meaning lots of different pieces to it. One specific thing that you're involved in, that you're doing, that helps achieve those outcomes.
Well, one of the things that we do at Englewood is we deal with the patient's specific needs, but we treat everybody universally with basically a bloodless algorithm, which is
a bloodless algorithm?
Yeah, it's
mean?
called patient blood management.
Right.
And this is not even on the map in many centers, but we've helped to put it on the map because it turns out that a large study from the Cleveland Clinic, in fact, demonstrated that if you apply techniques to reduce the risk of bleeding and transfusion, you will actually enhance outcomes. Your chance of surviving is improved. Your chance of rehospitalization is lessened. Complications such as kidney failure and infections are also diminished. Now that's just one thing, but I think it's important for people to be aware of that it's not just one fancy tool or one technique that makes for differences in outcome. It's important that the patient engage their doctor, communicate with their healthcare provider, and know the system in which they're participants or they're participating, so that they can really have their needs met in a cost-effective way.
But Doctor, it's interesting. You've also said that it's incumbent upon physicians to be more cost-conscious and understand that if they're prescribing medication for a patient who may or may not be able to afford it, that is relevant. And also that physicians need to be better communicators. So it's one thing to talk about patients being more engaged, but what role do physicians have in this process?
A critical role. You know, the physician is really part of a team. That team includes the patient and also other healthcare providers, technologists, nurses. Everybody contributes to the product. And sometimes we're too focused on these individual things, and we have to step back. And we've created a Heart and Vascular Institute of New Jersey to deal with this broader array so that people can work together as a team to produce better outcomes. We've achieved year after year, cardiac report card after cardiac report card, no deaths in cardiac surgery. We were the only program in the state of New Jersey that 2 years running had lower mortalities than the average program in the state of New Jersey in terms of 30-day mortality. In fact, we were nationally ranked. These are only achieved not by one specific magic bullet, but by systems that engage each member of the team so that the product is better, so that basically the patient is exposed to safer conditions and better outcomes. And you have to engage the patient. If you put in a fancy stent that requires a year of medicines that the patient can't afford, that stent can backfire on the patient. And by the way, we're very conservative on our stent use.
What does that mean, conservative?
Well, we only want to use stents where they're needed. There are now great medical studies that in some settings of stable coronary disease, for instance, you can get away with medicines alone and get great results. Unstable patients, heart attacks, they're better served with stents. But even with these fancy technologies, if you don't make the right decisions that are individualized for the patients, you will miss the mark in terms of achieving the best possible outcomes. We look for other contributing factors, such as obstructive sleep apnea. That is a major modifier of risk, not even asked about in many cardiology offices. Or
Why not?
It's beyond me. It is an epidemic. If you snore, if you're tired, if you take naps, that is a major driver of cardiovascular risk, from stroke to arrhythmias to heart failure to acute coronary syndromes, which is heart attacks. It's a major player. So we aggressively screen for that and treat it. And that is how we've achieved better outcomes and a leapfrog rating that really puts us in the highest echelon in terms of patient safety at our hospital.
By the way,
But it's a
Leapfrog
systems
is an
approach.
independent entity that evaluates and judges these things. Go ahead, I'm sorry, you were saying.
So it's a systems approach. It's not any one individual that does this, but it's working together. And I've been working in New Jersey for 25 years providing health care. And it's a thrill for me to be able to touch more lives than just the individual in front of me by working on this kind of policy, this kind of working together, this kind of teamwork, and also getting the word out to encourage patients to talk to their doctors, to know what the outcomes are. How is this going to benefit me? It's a dialogue.
You want your patients to be more assertive in the way they communicate, the way they ask questions. You want them to be so direct.
Absolutely.
It has an impact on outcomes?
No question. No question. Because, you know, the engaged patient is the one who's going to be motivated.
The engaged patient.
Yep. He's going to follow, or she is going to follow changes in their lifestyle, their diet, exercise, taking the medicines. It's not just showing up for the fancy procedure and bean counting how many of these you might do. It's really the whole paradigm of how is this patient going to be 10 and even 20 years down the road.
Commitment.
Compliance.
By the way, before I add it real quick, you told our producers that in terms of diagnostic procedures, more and more of them are going through the wrist and not through the groin, right?
Oh, yeah. I mean, and that's just one of the advances. You know, 5 years ago, it wasn't even on the map. 90% of our procedures now, both diagnostic and interventional, are now done through the wrist.
So many changes.
Which is less bleeding, less complications, less discomfort, quicker healing. And that is the whole thing behind patient blood management, thinking about the patient before, during, and after, simplifying their path so it's as safe as possible through a hospital system and even as outpatient follow-up.
Dr. Richard Goldweit, Chief of Interventional Cardiology at Englewood Hospital and Medical Center. There is so much going on in your field, but beyond the clinical side of it, clearly the passion and commitment on the part of the physician is essential. Thank you, Doctor.
Thank you.
We
Thanks for
appreciate it.
having me.
That's why we have important people who have important things to say right here, so stay with us. We'll be right back. Thank you, Doctor.
If you would like more information on this program, or if you'd like to express an opinion, email us at info@caucusnj.org. Visit us online at caucusnj.org, or find us on Facebook at facebook.com/Steve Adubato, Ph.D.
There she is, Christine Stearns, Vice President for Health and Legal Affairs, New Jersey Business and Industry Association. Good to see you.
Thank you very much for having me.
Let's narrow our focus. We could talk about all kinds of business issues, but we want to talk about the Affordable Care Act and the potential impact it has on your members. By the way, describe your membership.
We are a business association that's 21,000 businesses in the state of New Jersey, but the vast majority of our members are small businesses with fewer than 50 employees.
Why does that number matter? Why does that number 50 matter as it relates to the Affordable Care Act?
Because it makes a big difference the size of a company. If you have 50 or more full-time employees under the Affordable Care Act in 2014, you are going to need to offer those employees health insurance. So that is sort of the magic number in terms of at least some of the responsibilities that employers are going to have for compliance with the Affordable Care Act.
And if they do not?
And if they do not, they'll have to pay a penalty. And it could be $2,000 or $3,000 depending on the details. But so employers are watching, you know, are busy with their compliance efforts and understanding what they're going to need to do.
What are you hearing from your members about this? I mean, so many people across the country have different points of view depending upon their position and where they are and their perception of how the Affordable Care Act will impact them. But what do you hear from most of your members?
For most of our members, it is...
Because it's probably going to happen.
It is the law of the land.
Yes, it is.
And they are trying to understand what their responsibilities are. There is needed guidance. So there is a lot of confusion of what their responsibilities are. As we discussed, if you are over 50 employees, you have that penalty provision. If you have fewer than 50 employees, you have the prospect of the health insurance exchange.
We're going to talk about that.
As a new marketplace where you might be able to buy your health insurance. But there are numerous other provisions and aspects of the Affordable Care Act that are impacting employers in how they are providing their health insurance and their health insurance benefits. So what we're hearing from our members is, you know, how does this affect me? And also, will this help make my health insurance more affordable? Because that is, when it comes to health insurance, the top concern of employers. You know, in the last 10 years, it has topped our Business Outlook survey in terms of the concern of employers. And that's because in the last 10 years, the cost of health insurance has doubled.
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 What impact does it have? Christine, put that in perspective for people. People could talk about health care and the Affordable Care Act in the abstract, but then when you really get down to it, in terms of health care costs, when a business, because businesses, we're a small business, we're a not-for-profit, but we raise money, and part of that money goes to pay for the health insurance for our employees. And a business, be it a nonprofit or otherwise, they do the same thing, right? When healthcare costs go up, they double over a period of time. What impact does it have on the business?
Well, generally, businesses have a set amount of money that they can spend on salary and benefits for their employee. So as the health insurance piece of that pie continues to take a larger and larger...
From what to what? Give us perspective. On average, it's gone from what to what?
Well, right now, the most recent survey says nationally, health insurance benefits cost $5,000 for an individual employee,
right.
Or more than that, and more than $15,000 for a family. But when you look deeper, in the Northeast, it's closer to $7,000 for an individual employee and $17,000 for a family.
What does the employer pay?
Typically, for small employers, it's around $800 out of. The employee pays about $800 out of that $5,600 bill, so that the employer is still paying the vast majority of that premium, and so that is a big chunk out of, and that is money that otherwise would potentially go to salary increases for the employee. As we all know, health insurance is the benefit that employees are most interested in after their wages.
Right.
And so it is, and so small employers spend a lot of time comparing prices, comparing the benefits, because they're not just shopping for themselves, they are shopping
Families,
for
right?
their family too. And so that it is, a huge concern.
So how's the Affordable Care Act going to change that from the perspective of your members?
It is, the Affordable
So
Care...
are those numbers going down?
It's hard to see that that's going to happen.
Really?
The Affordable Care Act is largely designed to ensure access for more people
Right.
to health insurance, but it's not necessarily designed to bend the cost curve for those who already have coverage.
But Christine, won't the healthcare exchanges help reduce those costs? Because these exchanges, apparently on the internet we're talking about, you go on the internet and you shop for what you want. More competition, right?
But it's not going to really get at the underlying cost of healthcare and the utilization and the medical cost. It's going to perhaps provide more plans choices, but we already have a small employer market that provides access to a wide array of choices. They're not necessarily affordable by some people's estimation, but there are a wide array of choices. And so I'm not sure that the exchange on its own is going to do much to drive down the cost.
So what's going to happen to your members, which means other members of other people in the state, because your members employ lots of people in the state. So what do you see?
That's the concern. The concern is that what we've been seeing for the last few years is an erosion in the number of small employers who are able to afford to buy coverage in the small employer market. Now, certainly it's not just the premiums, it's the overall economy. We've had a really tough economy.
Right.
And so people have had to make really hard choices for small employers, but that's the concern.
That's the concern. By the way, folks, do yourself a favor, go out there, and while you log on to our website, we will hook you up to New Jersey Business, which is a publication you're very familiar with, right?
Yes.
Put out by the Business and Industry Association. Very important information. Christine Stearns, Vice President for Health and Legal Affairs, New Jersey Business and Industry Association. A lot to talk about, and you taught us a lot today. Thank you.
Thank you. Thank you.
The preceding program has been a production of the Caucus Educational Corporation, celebrating 25 years of broadcast excellence, and 13 for WNET, NJTV, and WHYY. Funding for this edition of Caucus, New Jersey has been provided by QualCare Inc., a local managed care company covering 750,000 New Jersey residents. Verizon Communications, and by Sun National Bank. Promotional support provided by NJ Biz, All Business, All New Jersey, The Star Ledger, and NJ.com, Everything Jersey. And by the New Jersey Business and Industry Association and its monthly magazine, New Jersey Business. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. Caucus, New Jersey has been produced in partnership with TriStar Studios.
New Jersey Manufacturers Insurance Company offers policies that can protect against auto accidents, fires, windstorms, floods, and many other serious and urgent situations. Tips on what to do before, during, and after you're confronted with the unexpected are on the emergency preparedness section of njm.com. New Jersey Manufacturers, helping the Garden State prepare for the unexpected for nearly a century.
This is One-on-One.
I'm a fool for you, babe.
Join me as we get up close and personal with some of today's most compelling personalities.
This is one you can't afford to miss.
Weeknights at 7 and 11:30 p.m. on NJTV and 12:30 a.m. on 13.